Sleep apnea is a common disorder in which you have one or more pauses in breathing while sleeping. It often goes undiagnosed, and doctors usually can't detect this condition during routine office visits. We went to Desert Regional Medical Center and spoke to cardiologist Dr. Bagheri. He tells us why a cardiologist would be so interested in this condition.
Sleep apnea is a breathing disorder, is a sleep disorder, and very commonly not diagnosed and missed, even by most experienced primary care physicians. Because it's a condition that unless you specifically question about, you may not diagnose it. Commonly I see that patients tell me that their wife or companion wakes them up frightened because they think that they're dead, they're no longer breathing. There's an official way to diagnose it and address the treatment, and that would be a sleep study, which basically inquires patients going to a sleep center, sleeping overnight. They monitor the sleeping pattern and brain activities, and just watch the patient throughout their sleep, and they can detect how many episodes of apnea the patient has per hour, how long they last, how much the oxygen saturation drops. The problem with the sleep apnea is not just, well, you don't breathe for a few seconds. What's the big deal? The problem is during that few seconds, the oxygen level in the whole body, in the blood system, blood circulation, it drops significantly low, and the brain basically suffocates. So as a result of that asphyxiation, the blood oxygen level is dropping. The whole body gets stressed out as a result of this. In response to this stress, this sheer stress, stress hormones are released, which will result in the next day hypertension. The blood pressure goes up. And eventually they may result in permanent hypertension. They may result in a condition that we call pulmonary hypertension, which is a buildup of pressure in the arterial system in the lungs, and may affect the right side of the heart and cause heart failure. The stress hormone do increase the inflammatory markers in the blood circulation, and you know inflammation can result in many other issues, including heart attacks and a stroke.
What are the treatment options for sleep apnea?
There are several treatments that we can do, and based on the type of a sleep apnea, there's basically two distinct types. The most common one is obstructive sleep apnea, which is because of an obstruction in the airway, upper airway, most commonly the soft palate. And then the less common condition, which is about 10–15% of apnea cases, is a central apnea, which is basically brain stops sending the impulses that are required for inspiration. If you're dealing with the most common type of a sleep apnea, a CPAP machine, which is a continuous positive airway pressure, and comes in form of a face mask or a nasal mask, would help and would alleviate this condition. And all of that inflammation and the stress hormones, everything would be reversed, as if the patient does not have this condition. The problem is many people may not tolerate it. In those cases, we can consider a curative surgery, which is resection of that portion of the soft palate that is causing the obstruction, and that's going to cure the sleep apnea. For the central type of sleep apnea, there is a different type of machine called VPAP, variable positive airway pressures, and that's going to eliminate this condition too. Another common condition that a sleep apnea causes is atrial fibrillation, which is an irregular heart rhythm. And we do know that sleep apnea results in electrical remodeling in the electrical circuits of the heart, believe it or not. And after a while, this electrical remodeling will result in loss of the regular heartbeat, development of irregular heartbeat, atrial fibrillation, and that's going to put the patient at higher risk of a stroke. We know that by treating sleep apnea, we can reduce the burden of atrial fibrillation, lower the risk of a stroke, and that's mainly why I'm interested in treating it.